Hi, and welcome to this short webinar about the 3 steps that you need to do to resolve your sciatica. My name is Dr. Ron Miller. I'm one of the lead specialists here at Pursuit Physiotherapy. And if you're watching this video, you're probably dealing with some sort of sciatica, whether you're just looking for relief and trying to solve the root cause, or if you failed multiple treatment approaches. It's like pain is not normal and your body is telling you that something's wrong. So it's just a matter of finding the right specialist to solve the root cause and get you some relief. And you're watching this, if you want to get pain-free fast, we do things different here. We have an innovative treatment approach that has been proven to work for sciatica no matter the root cause. So, you know, my goal is that you end up following us and you get testimony and you write a testimony like this, where do you believe in miracles? I was pain-free after 2 treatments. My back feels better than it's felt in at least a decade. So even if you're a complex case, we can still solve the root cause of this. And we're the only clinic that I've ever heard of that actually has a money-back guarantee. And we're not saying that our treatment works on every single patient. It's just that if you failed multiple treatment approaches, we believe it's not right for you to pay money if you're not getting results. So we do see a lot of complex cases here. So as a rest assured, if you do come here and you're not seeing the results you want, we'll just give you a full refund. So no one else does that in all of healthcare. So what are the 3 simple steps that you need to learn in order to get pain-free? So phase 1 of rehab is all about solving the root cause of your pain. Now, off the top of my head, you could have a herniated disc or even discogenic symptoms that are causing sciatica. You could have more of stenosis or a compression type of sciatica. You could have piriformis syndrome. Your SI joint could even be causing some referral of pain that goes down the leg. You could have trigger points in some of the glute muscles that's causing pain to shoot down the leg. And then a lot of times with chronic cases, either post-surgery or having multiple episodes of back pain, the sciatic nerve can actually get tight, and that's called neural tension. Okay, so right there are the most common 5 to 6 root causes or different types of sciatica. You can see that if you truly have a herniated disc and they treat you for piriformis syndrome in the glute and the hip area, that they're missing the root cause. The first and most essential step to any treatment plan, especially in phase 1 of recovery, is to solve that root cause. You also want to highlight any underlying risk factors of what's causing the pain to come back. I mean, like many times people will have sciatica, they'll go on some pain meds, it goes away, but then in a week later, it starts to come back. These are some cases that you're missing some underlying risk factors. And the primary goal of phase 1 is to solve that root cause, address those underlying risk factors, and get pain to come down. Specifically with sciatica cases, you want it to centralize, meaning you want that leg pain to come out of the leg and more into the low back region. Okay. We expect patients to get a 50% reduction in pain in the matter of the first 2 weeks. And we know that we solved the root cause and you're responding to treatment good. Most of the time in phase 1, we're all about getting pain to go down. Okay. It's not about light strengthening, but eventually you may do some light strengthening. But the number 1 step, the first step you have to do is to solve the root cause. This is another analogy here. If you step on a tack, your body's going to have instant pain. Okay. You just can't take some oxycodone or some morphine and like, I don't feel pain anymore, so my problem's solved, and just walk around with a tack in your foot. As soon as the medication wears off, the tack's still in the foot. Okay. So you have to identify the tack and remove the tack. It's not something we're covering up symptoms with. You need to solve the root cause here. As long as you have that tack in your foot walking around, your pain will always come back. Okay. It's not just taking some meds or doing some stim or temporary relief of pain. You have to solve the root cause and those underlying risk factors to make sure that your pain goes away and stays away. So the number 1 most important thing, if you forget anything from this video, make sure you identify the root cause and solve it of what's causing your type of sciatica. So in phase 2 is getting pain down even more, and the goal is to optimally get it down to 0 if that's a realistic goal for you. We want to increase flexibility, so you'll see an increase in flexibility and a decrease in pain still until you get down to the maximum level, which is 0. And here with the increased flexibility, that should solve any of those underlying risk factors. And then now you can start strengthening in a pain-free range of motion without causing flare-ups. So in phase two, the pain continues to go down as mobility and flexibility goes up. You should see this inverse correlation here where pain's going down and flexibility goes up. And normally that happens anywhere from 2 weeks to 4 weeks, depending on your case. In phase three, this is the main time where you should be symptom free, fully centralized, no more flare ups. You make some strength progressions. Now you start strengthening to make sure you get those muscles strong again. Um, Many times having pain for weeks and months, your muscles get shut down with that. So you have to get that strength back. So the next time you pick up something, you don't get a whole flare up again. Now is the phase where you do a lot of strengthening, and then it's a return to sport phase. Getting back to your favorite activities, doing a return to run program, a golf program, whatever you want to do, dance. Then you start working back into it to make sure that you don't get a flare up. So the key point of phase three is pain free and your return to activity. So this was an interesting case. Terry came in. She actually had back surgery, and for sciatica came out was still having sciatica. So the surgery area where they did it was not the root cause, but thankfully after surgery we were still able to solve the root cause of her sciatica, and she was able to get back to being pain-free and going on her walks again. So overall, of this whole short webinar, the first step in order to get pain-free is to solve that root cause. And if you're struggling with treatments or you're not getting results, they missed the root cause. So the best next step is to come in for a pursuit evaluation. What most patients do, they come in, they get all their questions answered. We solve the root cause. We kind of build a customized treatment plan, and then the patient decides on what's best for them. So with our evals, which we do things that are slightly different than most here. Our evals are 60 to 90 minutes long with a board certified specialist. We'll solve the root cause of your pain and highlight any underlying risk factors that you may have. You'll learn exactly what's the best and most effective way to treat your type of sciatica, and you'll get an accurate timeline on when to expect results. Easy cases of sciatica should resolve in as fast as 2 to 6 sessions, and you could be done in 2 weeks. Complex cases of sciatica that have been going on for months and years, it may take a few months to get better, but you'll have an accurate timeline on when you should expect results and when you should be in phase one, phase two, and phase three. Everything that we do here is customized. We don't do any cookie cutter standard treatment approaches. It's not like you're going to walk in and look down and see everyone doing the exact same exercises. Everything is customized, and we believe that we owe it to you to do what's best for you to get you pain-free in the fewest amount of sessions. So based on your type of sciatica, everything's going to be customized for your type and to get you relief fast. You also get a recovery phase outline. All of our patients get 24/7 unlimited access to your doctor of physical therapy, so you can text us or email us questions, and get real-time feedback. We have easy and effective communication. We have a concierge specialist. Jade, she'll make sure that you're taken care of. We have flexible and convenient scheduling. We can still get you in this week if you call, and there's no waiting times. I think it's so annoying whenever you're suffering in pain or something, and then you have to wait 2 months to see the specialist. That's not acceptable, and we have to do it better. So we don't have any waiting times, and normally we can get you in within the week. Some of the bonuses during the eval, you're going to get treatment day one. There's no sense in us telling you what's wrong but not doing anything about it. So we're going to do treatment on day one to try to get you relief. And then you're also going to get a customized video-based home program that you can start doing some things at home to help centralize that pain and to provide relief. We'll provide any mobility equipment needed, and we also have a money-back guarantee that our packages, if you're not getting results or any type of relief in the first 2 to 4 sessions, we believe it's not right to ask you to pay for services, and we'll give you your money back. So our evaluations cost $220. So if you're looking forward to getting started, we can definitely get you in still. But this is the price for our evals. And then here's a real life case study breakdown. So Julie C had sciatica for over the past year. She consulted with 3 different surgeons. They all said that she had a herniated disc in her back, and they all wanted to do surgery. And it's been almost like a year now, and she didn't want to do surgery. So she came and saw me. I did a thorough assessment. She actually had a case of that neural tension where she had a herniated disc back then, but it already healed. It healed with time. A perfect example is I have a herniated disc in my low back and I don't have any back pain. So she probably had a herniated disc type of sciatica at first, but it's been like a year now and it healed, but the sciatic nerve healed tight. So she was still getting these different symptoms that didn't present like a herniated disc type of sciatica. We solved the root cause. It was a neural tension problem. She had some underlying risk factors that we had to also solve too. But then in a matter of a few weeks, her pain went from a 9 to a 0, and she didn't need surgery. And she got back to running on her mom's Run This Town group, got back to running pain free, good to go. We solved the root cause. So that's a perfect example of what we're talking about, going through each phase and solving the root cause. Because if they went and did surgery on the herniated disc, they would have missed the whole root cause. So if you have any questions, or if you're ready to get started, you can just click on the links below. You can visit us at pursuittherapy.com, or if you have any specific questions for us, you can call us or text us, and the concierge specialist will answer any questions that you may have. So I hope this helped you a little bit and helped educate you about what the next steps are to help resolve sciatica. We hope to hear from you soon. And thanks again for tuning in. And we hope you choose us to provide treatment to you. And we'll see you soon.